Dear colleagues, welcome to the OncoAlert Roundup for day 3 of ASCO 25. I'm excited to share with you some of the most impactful data presented on day 3. Now, please remember that day 3 saw many great trials, and these are just 4 of my favorites. So if you want to take a deeper dive, we advise you to download the OncoAlert daily newsletter for ASCO 25. This is a newsletter that's coming out every day at 6:30 in the morning, and it will have a more complete view on the actual picks that we have for all of day 3. So you can register by going on www.oncoalert360.com or by clicking on the link below. That's www.oncoalert360.com. First up is the challenge trial. This is a remarkable phase 3 study exploring the role of structured exercise in colon cancer survivorship. This trial enrolled patients with resected colon cancer who had completed adjuvant chemotherapy. Participants were randomized to either a 3-year structured exercise program or standard health education alone. The results were actually compelling. Those in the exercise group had significantly improved disease-free survival at 5 years, 80.3% versus 73.9%, and evidence also suggests a survival benefit extending to 8 years, with overall survival at 90.3% compared to 83.2% in controls. While there was a slightly higher rate of musculoskeletal side effects in the exercise group, the benefits in terms of cancer control and survival clearly outweigh these risks. This trial powerfully underscores the role of lifestyle interventions as adjuncts to traditional cancer therapy and highlights how structured exercise can become an integral part of survivorship care plans. Next, we have the MATTERHORN trial, which brought promising results for patients with resectable gastric and gastroesophageal junction adenocarcinoma. This multinational phase 3 study evaluated the addition of perioperative Durvalumab, a PD-L1 inhibitor, to the standard FLOT chemotherapy regimen. Patients receiving Durvalumab experienced a higher 2-year event-free survival, 67.4%, compared to 58.5% with chemotherapy alone, as well as a notable increase in pathological complete response rates, nearly tripling from 7.2% to 19.2%. Importantly, these improvements came without added toxicity or delays in surgery and adjuvant therapy. This suggests that combining immunotherapy with chemotherapy in the perioperative setting offers a more effective and tolerable approach, potentially setting a new standard for managing an aggressive disease. And we turn to advanced breast cancer. The SERENA-6 trial examining a precision medicine strategy in ER-positive, HER2-negative disease with emerging ESR1 mutation, a common mechanism of resistance to aromatase inhibitors. Using circulating tumor DNA to detect these mutations early, patients switched from their aromatase inhibitor to camizestrant, a next-generation selective estrogen receptor degrader, while continuing CDK4/6 inhibitors. The switch resulted in significant improvement in progression-free survival, extending median PFS from 9.2 to 16 months, nearly doubling the time patients remained on effective therapy. Quality of life was better preserved, and treatment discontinuation due to side effects remained low. These findings are practice-changing, demonstrating that molecular monitoring can guide timely therapeutic shifts and improve outcomes in this common subtype of advanced breast cancer. Finally, we have the ATOMIC trial. This offers a new standard of care for stage 3 colon cancer patients with deficient mismatch repair. This phase 3 study tested the addition of Atezolizumab, an anti-PD-L1 antibody, to standard adjuvant modified FOLFOX6 chemotherapy. The combination led to a dramatic improvement in 3 years disease-free survival, 86.4% versus 76.6% with chemotherapy alone, with consistent benefits across age groups and risk profiles. While grade 3 or higher adverse events were modestly increased, the regimen was overall well tolerated. This landmark trial confirms the critical role of immunotherapy in the adjuvant setting for mismatch repair deficient colon cancer, redefining treatment landscape for these patients. In summary, day 3 of ASCO showcased groundbreaking advances, from the power of exercise to enhance colon cancer outcomes, to the integration of immunotherapy in gastric cancer and adjuvant colon cancer, and precision endocrine therapy tailored by molecular detection in breast cancer. These trials exemplify the multifaceted progress we're making in cancer care, combining lifestyle, immunotherapy, and targeted approaches to improve survival and quality of life for our patients. And that is a roundup for day 3. We thank you all for your support, and we look forward to an exciting day 4 of ASCO 25.